Keeping a healthy vagina, maintaining a healthy vagina is the core of a woman's being. The vagina has a pH, a potential of hydrogen of 4.5, approximately 4.5, and it contains healthy bacteria, lactobacilli, that maintains pH, that gives it a healthy environment, thus preventing any form of foul odors, any form of funny discharge, infections, and what have you. And also, it also helps with self-lubrication. That means when it's at a good pH, that 4.5, approximately 4.5, you are going to self-lubricate rightly. Now, nota bene, whenever you hear me say, or whenever you read on the internet how to wash or clean your vagina, they aren't talking about the unseen or the hidden part of your genitals. They are talking about the visible part of your genitals, and that is the vulva. The vulva that contains the clitoris, the labia minora, and the labia majora. So when it comes to cleaning the vagina, your genitals, don't attempt to clean the hidden part, the part where the tampon goes in, the part where the baby comes out through, the part where menses come out through, the part where a man's member goes through. You're only supposed to clean or wash the outer area of the genitalia, and you have to wash it with mild soap and a hand towel. And the reasons why you don't have to only use water is because your body produces smegma. It produces also dead cells, and an accumulation of your body oils, sweat, these dead cells, it's a good medium for bacteria to grow. And if you don't wash properly, you start getting fungal infections, itches, and not only that, you are going to also transfer these infections into your vagina in the long run and into your urethra, causing urinary tract infections. So what are we waiting for? Let's roll in. The first on our list is lubricants, and we are talking about vegetable oils and non-vegetable oils. Examples of vegetable oils are coconut oil, argan oil, olive oil, castor oil, hemp seed oil, macadamia oil, and what have you. And examples of non-vegetable oils are paraffin liquidum, also known as white oil or liquid Vaseline. Examples on the market are your Johnson baby oil, and some people also use semi-solid paraffin liquidum. Example of a brand is Vaseline. I did a video explaining in details why you shouldn't use any of these. And number one is because the pH of these oils is higher than the pH of the vagina. For example, coconut oil has a pH of approximately 11. And the pH of liquid paraffin is approximately about 11 as well. So when you put that into your vagina, or when you use it as a lubricant, you change or you alter that natural pH, and this natural good bacteria cannot protect your vagina from infections anymore. So you are prone to funny smells, you are prone to funny discharges, infections, and what have you. Secondly, some of the oils particularly contain artificial perfumes and artificial flavoring, and which is not good. So don't go into your supermarket and grab whatever you have, or enter your kitchen and grab whatever you have there as a vegetable oil or a non-vegetable oil and take it to your bedroom. If you want to use oil-based lubricants, make sure you go to the pharmacy and you ask for a certified brand, a brand that has been certified and that have adjusted the pH of these vegetable oils, and you can use them now in the bedroom. Number two on our list, and is the most common, is an unclean penis. I've received a lot of emails from many ladies telling me that they have been on treatment, antifungal treatments, antibacterial treatment for recurrent or reoccurring vaginal infections, and it doesn't seem to go away. The first thing I always tell them is to make sure their partner's penis is clean and that they have a healthy lifestyle. That means their hygiene down there is good. They don't clean from the back to front and they wear cotton underwear, etc. Now, the most important is if your partner is unhygienic and if your partner is not circumcised. An uncircumcised penis often has an accumulation of smegma. Smegma contains sweat, sebum, and dead cells. When it accumulates, it can lead to balanitis, it can lead to phimosis, and it can also lead to penile cancer. And even if your spouse is circumcised, if he doesn't wash properly, you are going to keep having recurrent vaginal infections. Make sure you wash before sex. And even though your partner washes, let him wash properly. I did a video on the things you should do before sex and also a video things you should do after sex. Watch that video and it's going to help you to minimize infections, to minimize the transfer of urinary tract infections or sexually transmitted diseases. Hence, it is very important that as a lady, when you are going for a checkup or when you are taking these treatments, take your partner along with you. Make sure he gets tested as well and he's going through a treatment. And also, you share this video with him so he gets enlightened. He has to make sure he pulls back his foreskin and wash properly. It's very important that he should wash twice a day, morning and evening. And if he has any form of bacterial infection or fungal infection on his penis, he should get it treated because you keep having vaginal infections. It will be pointless if you as a woman are taking treatments to eradicate some form of vaginal infection and you haven't screened your partner as well. You haven't taken your partner for tests and make sure he's being treated as well. Number 3 on our list that is also common is unclean fingers and dirty nails. This is particularly for people who don't shower before having sex, and particularly for people who have nail fungus. Also for ladies who wear artificial nails. Take note, there are some women who finger themselves. And also for people who double dip. That means you use your fingers, you put in the anal passage, you carry bacteria, fecal bacteria into the vagina, and sometimes you can take from the mouth, you take to the vagina. In fact, you do double dipping. You are going to keep having recurring or recurrent infections. It's very important that you trim the nails. You also clean and make sure that there's no dirt underneath your nails or your spouse's nails. And if you're wearing artificial nails, make sure they are well clean underneath. If you have fungal infections on your nails, please make sure it doesn't go into your vagina. And if you're using sex toys, don't double dip. If you're using your fingers or sex toys, don't do double dipping. Go into anus, go into vagina, go into mouth, go into vagina. It's going to make you take medications all through. The 4th on our list is unclean tongue and toes. A lot of people have a lot of fetish. They insert their toes into their partner's vagina as a form of arousal during foreplay. Another is the tongue. Most people have microorganisms in their mouth, but they don't show symptoms, physical symptoms. Some people have oral chlamydia, oral herpes, oral syphilis, oral gonorrhea. They also have candida infections in their mouth. And sometimes they will not even have a mouth odor or anything because their immune system is real good. Now, when they take their mouth or their tongue and put it into your vagina, they transfer these microorganisms, these diseases into your vagina, and you begin to have either chlamydia, either gonorrhea, herpes, syphilis, and also candida, which is thrush. Now, sometimes the person may not have a white tongue, the person may not have the symptoms of a bad breath or mouth odors, but they could actually be carrying oral candida. What you should never allow is anyone who has tonsillitis, sore throat, a cavity, a hole in the teeth, mouth odor, gingivitis, cavities, to actually put their tongue into your vagina or even give you oral sex. It's a no. Number 5 is douching with water from antiseptic solutions, for example, Dettol or Bactol, whatever you have in your country. Also, infused cloves, infused cardamom, cinnamon, yoni pearls, and what have you. Most women would infuse this and take a pump and take the water and pump it into their vagina and lay on their back, or they could even sleep with it with the aim of tightening, rejuvenating, and cleansing. The issue with this is you would obviously change the flora and kill this good bacteria and expose yourself to infections, funny discharge, and funny smell. You would also cause vaginal dryness. And when you have vaginal dryness, it will lead to vaginal tears and you will experience bleeding after sex. And if the disease is not treated or if not noticed with time, it may lead to pelvic inflammatory disease and, in the long run, to infertility. So it's very important that you disease from this. You stop these practices. I know this has been practiced in several communities, but many people were not informed. But you, as a smart and an enlightened person, should take these to your community and teach them. The 6th on our list is the use of oral drugs or oral contraceptives. What I notice is that some people are ignorant. They will take an oral drug, maybe it's oral nystatin, and they will insert it in their vagina. They will take a 24-hour pill or an emergency contraceptive pill, and they will insert it in their vagina as a pessary. So some people do this out of ignorance. Some people will do this because they are trying to either make the situation go away as fast as possible, especially if you are trying to prevent yourself from getting pregnant, or maybe you have been having recurrent or recurring vaginal infections or itches. Some people will take an antibiotic. When they swallow thick one, they'll put one into their vagina. This is so wrong. The absorption rates are not the same. It's not the same. The walls of your vagina, the way it absorbs is different from the way your body absorbs, your inner system absorbs. Remember that every drug is manufactured taking into consideration the pharmacodynamics and the pharmacokinetics. And that is the way the drugs react to the body and the way the body reacts on the drug. So it's important that you read the leaflet and you don't self-medicate. You don't go to the pharmacy. You don't ask Dr. Google. You read, you go to the pharmacy or to the local drugstores and you grab anything and you take and you insert into yourself. It's very, very damaging to you in the present and in the long run. Number 7 is the use of herbs. For example, cloves, cardamom, cinnamon, or any herbs that has a good aroma and flavoring with the intention or the aim of perfuming your vagina. This is a practice that happens in several communities, particularly when the lady is about to have her first night with her husband, or just as a cultural ritual or a cultural activity among several females. So when a lady notices that she maybe not smell real good, or maybe she fantasizes of herself smelling very aromatic like cloves, she would infuse this herb Or she would mash it as a paste and put it into her vagina and sleep with it for a couple of days or maybe an overnight. And then she knows that she has perfumed her vagina. But let me tell you the truth. What you're doing is very dangerous. Not only are you going to get infections, the little microparticles that you leave in your vagina can actually cause vaginitis, inflammation, irritations, allergies, and cause vaginal dryness. That will lead to vaginal tears and bleeding during sex. So if you want to, let me say, change the way you smell, why don't you eat foods that are high in sugars? I did a video on this. I did a video on how your vagina should taste if you want to improve the taste of your vagina. You can have or eat fruits like pineapples, eat fruits like watermelon, etc. Watch that video so you can get enlightened. It will help you because what you eat also has an influence on how you smell and how you taste down there. Nota bene, if you are taking any form of medication, it can affect the way you smell and you taste down there. Please don't be too hard on yourself. Remember that your smell is homely, subtle, and unique to you. Number 8 on our list is the use of dairy products, particularly probiotic yogurts. Science has proven that probiotic yogurts contain lactobacilli, and this is the same healthy bacteria that is found in the vagina. Now, some doctors would advise ladies that when they start noticing some itches down there, they should take a tampon or a sanitary towel, cut it, roll it, dip it in a Greek yogurt, a probiotic yogurt, and they insert it into their vagina for a couple of hours, or they can sleep with it overnight. Now, this is very bad. Point number 1, it may contain flavoring, preservatives, and other additives that are not good. And it may contain sugars. Now, some people will say, what if I used a yogurt that is not sweet, that is not flavored? Is it still dangerous for me? Yes. Look at the process of fermentation. Look at the preservative that is being used and the different additives that are being put in making this yogurt. It could be very dangerous for you. Number 9 on our list is the use of essential oils, perfumes, hydrosols, body sprays to flavor or to fragrance our vaginas. Now, what I see some people do is they will take essential oils, they will take a hydrosol or a perfume or a body spray or eau de toilette, and they will use a tampon and spray some on it or put some on it and insert it, or they will just lay back and they will try to see if they can spray this in and put some of this in, particularly at the vulva area, the outer part, the visible part of your genitals, and also make sure some goes in. Some ladies do this to flavor or to fragrance their vaginas. This is very dangerous. Alcohol is not good. It will cause vaginal dryness. Also, the concentration you use, it's very dangerous. Remember, you should not kill and never do anything to kill this healthy bacteria, because once they die, your vagina is open to any disease and any form of complication. So if you notice you have this foul smell, go to the hospital, get a vaginal swab, let it be cultured, and let an antibiogram be done, and you'll be prescribed medication. Take it for the period of time that you have been told to. There are several microorganisms that can cause you to have a foul smell, a funny discharge, vaginal itches. You can have this caused by viruses, bacteria, fungi, and even parasites. This is why it's important not to ask Dr. Google, but to go for tests, get a proper diagnosis, get a proper prescription, and you can be treated. Number 10 is very common, saliva. Now, some people use saliva because it is very close to the seminal fluid or the self-lubricating fluid that a woman's body produces during arousal or during intimacy. Like I explained earlier, with the point of using the tongue, your mouth contains microorganisms and it may contain infections that don't show any symptoms. And if you use this saliva, you may actually infect yourself. Some women will be asking me, what if I use my saliva? What if I brush up? What if I use an antiseptic mouthwash before intercourse, before we use our saliva? Bear in mind, antiseptic mouthwashes don't kill viruses, bacteria, fungi, parasites. They don't treat infections like herpes, oral gonorrhea, oral chlamydia, and what have you. So remember that an antiseptic mouthwash, the use of an antiseptic mouthwash or the use of brushing is to reduce the load, the microbial load in your mouth. Now, what's also dangerous is if this person has tonsillitis, a sore throat, has gingivitis, has cavities, has a hole in the tooth where food can easily decay. So make sure you don't use saliva. Your saliva or your husband's or your spouse's saliva. You go, you get your water lubricant, you get your oil lubricant, you get your silicone lubricant, and you'll be okay. And if you don't want to incorporate any form of lubricants from the pharmacy, you can arouse properly. You can actually make sure that you self-lubricate well. I did a video on how to get wet, trying to get wet. And I know that that video has helped several couples and it's still helping them. Watch that video and stay enlightened. Number 11 on our list is the use of fruits and vegetables. For example, we have carrots, cucumbers, courgettes, aubergines, etc. A lot of people use this as dildos or to arouse themselves, and it's very wrong. Some people will say, I wash it, so I've used it. I use sodium bicarbonate. I sterilized it, so I can still use it. No, the skin will still contain chemicals on it, chemical fertilizers, chemical manure, which has actually penetrated through the skin of the fruit or the vegetable you're using. So while you insert this into yourself, know that these chemicals are also being released because of the slight heat that is being produced during the inward and outward movement of that fruit or vegetables during your arousal or intimate moments. Number 12 is an unclean or shared sex toy. That means you don't wash it, you don't disinfect it, and you do double dipping. You take from the anus, you put into the vagina, you share it with several people, let's say those who are doing threesomes, those who have multiple partners. Please, it's not good. It will expose you to a lot of infections. Nota bene, you can get microorganisms transferred from one part of your body to the other. You can get infections transferred from one area of your body to the other. In this case, let's talk about your mouth. Let's take, for example, that somebody who has oral chlamydia actually gives you oral sex. You actually have oral sex with this person, cunnilingus with this person. Do you know that if that oral chlamydia, that bacteria, that microorganism that causes oral chlamydia goes into you, it may take some time for it to be noticed. It can be asymptomatic in you. And as a lady, when it begins to increase, when the microbial load begins to increase, and you don't go for treatment, or if you don't notice it on time, it can lead to pelvic inflammatory diseases, and it may cause infertility. If you are involved in oral sex, make sure you actually screen yourself every 3 months. You and your partner do screening after every 3 months, whether you're married or not married. Number 13 is the use of ingredients or products for vaginal tightening. I did a video on 4 ways you can tighten your vagina, scientific proven ways you can tighten your vagina with no complications at all. And a lot of women are enjoying the benefits and seeing results. Watch these videos, incorporate 1 or 2 of these methods in your lifestyle and enjoy the benefits. Some people use yoni pearls, some people use alum, some people use some form of crystals that are on the market, methyl crystals on the market, and they put it in. And cloves, they put a lot of things into their vagina for tightening. The disadvantage of this is it's going to cause you vagina dryness, infection, and some people think it really works, but it's just going to make your vagina feel dry. And when you feel that dryness or you sense that dryness, you are going to think that your vagina has been tightened. But no. One of the things that this ingredient does is once you use it and it causes vaginal dryness, it actually stops natural vaginal lubrication. It kind of destroys the cilia, the vaginal walls, and that lubrication doesn't come naturally as it used to. Number 14 is the use of tampons or sanitary towels. Some women actually would take out a tampon that has menstrual blood on it. They could pee, they could poop, and they will insert it back into them. Some women actually use sanitary towels. They could cut it, they will roll it, and they'll insert it. Some women will use a cloth, depending on which community you are in. After some time, without disposing of it, if it's disposable, or without washing it, if it's a washable type, they will insert it back into them. Now, this is what is so bad. Once blood is exposed to air, oxidation begins. Now, when you insert this tampon, this sanitary towel, or this cloth you use, or you are using, or you have used back into your vagina, what happens is decay begins. Degrading of the blood begins. Now, you are exposing yourself to vaginal infections, bacterial infections. Have you ever noticed that whenever you take out your tampon and you keep it out for a few hours, you don't only notice that it starts to smell, but you notice that the color of the blood changes. Once you take it out of your body, use a new one. Even if you have shortage of it, it's very dangerous. Number 15 is very common as well, using soap. This is particularly for partners, for people who love to have sex in the shower and in the bathtub, where they have put in, a lot of shower gel, bubbling, bath bombs in it, and you're in it. And what happens, although the sex may be enjoyable, remember, soap contains sodium hydroxide. Lie. And it's not good. You are going to get vaginal dryness. So make sure your partner rinses off himself and you rinse up yourself before he penetrates you. Please share this video with your spouse. Don't use a 1 minute, 2 minute pleasure to damage yourself down there, to compromise your vaginal health. The next point that is very common is having sex in a swimming pool or in a jacuzzi. Now, we all know that chemicals are being put into these. Whether it's private, whether it's public, these waters always contain bleach, disinfectants, some form of cleaning agents that have been put in them. So while you come and you're having sex with your spouse in a jacuzzi, in a swimming pool, know that all of this is going to mess up your natural bacteria down there. It will kill this lactobacilli and expose you to infections, complications, funny smell, vaginal dryness, and what have you. Number 17 is not spoken of. It's not very common, but it really happens. urine in the vagina. And this happens behind closed doors, especially to women who are into prostitution, who are into rituals, evil rituals. Now, some women who are into prostitution, if they meet a man or a woman who is into rituals, ungodly or satanic rituals, or if the prostitute herself or the woman herself is into unclean or demonic rituals, what happens behind closed doors is she gets urine, she can get urine put in her mouth, they'll be forced her to swallow, or they will pee in her vagina. I haven't heard of this from one person, from two people, from three people. It happens especially when a lady has given up herself to get money. And they'll pay you a lot of money, but they'll do a lot of things to you. They can even poop in your mouth and ask you to swallow. You'll be gang raped. You'll sleep with several men. They could pee in you. They could do anything, pour anything they want in you. So it's not good. Urea is not good in your vagina. And not only that, urine contains also some other microorganisms that are not good down there. So I hope you have learned from these 17 points that I have given you. I know you are shocked. You're like, wow, does this really happen? Oh, yes, it does. When I read my emails, I can tell you I am shocked as well. So I'm happy to help you. I'm happy to help you maintain your vaginal health. I'm happy that you're empowered, you're enlightened, you're sensitized, you're being educated. And I know that you pass this video down to many people in your community. You share this with your partners, your spouse. Thank you for joining me in today's class. I remain your seasoned medical microbiologist, Gwendolyn Halle.